Welcome back to the Wicked Psychology live stream of Maya Kowalski's case. Today we're going to continue with Maya's testimony from yesterday's live stream. Real quick, the overarching story is that she's a young girl who was held by Johns Hopkins All Children's Hospital. She was suffering from complex regional pain syndrome, CRPS, and initially receiving ketamine infusion therapy for her condition. However, when she was brought to the hospital, the situation escalated due to a misunderstanding of her condition and treatment, and she was held at the hospital away from her parents for concerns of Munchausen by proxy. All right, so we are going to start with Maya's testimony, and then we're also going to hear some recordings between Maya and her mother while she was at the hospital.
Infamous October 7th admission. I want you to tell the jury at this point in the midst of your relapse, your first relapse, what symptoms you had.
I had the same burning pain, but this time it was more amplified than it was when I was getting the infusions. And I had lesions coming back. I had discoloration and change in temperatures. And my dystonia was more prevalent. Sorry, I forgot.
And you were obviously in a wheelchair?
Still in a wheelchair.
Now, before October 7th, had you had this problem in the gut with being able to pass food through because of the CRPS?
That was a problem that was more with my CRPS, yes, constipation.
Mm-hmm. Okay. And had you been to Johns Hopkins the week before, October 1st, to visit?
Yes.
And what was that for? Was it for the same thing, the stomach issues,
Yes.
Lower stomach issues? Okay. And at this point, you were what, 10 years old?
I was 10.
All right. So let's talk a little bit about that visit. So do you remember the why of going there that day, that morning?
October 7th?
The 7th.
Okay. Yes. So I was in excruciating pain, and this time my stomach was also it was awful. I was complaining. My knees were up to my chest. I was crying. So my dad took me in.
All right. So it was your father, not
Yes.
your mother, that took you in?
And then the week prior, my dad also took me in.
Mm-hmm. Tell me something. When you would go back to Johns Hopkins or any of the doctors there, were they immediately aware of the history, or did your dad or mom have to explain it every time, your history?
Speculation overall.
Actually, yeah, my parents always had to re-explain my history of CRPS.
From what you saw, was this frustrating for your family, your mom and dad, to have to explain the same thing every time you come in?
Most definitely.
All right. So you come in, and your dad gives the summary of, or describes your history. What do you recall after that?
I remember just being in the ER, but I wasn't in the ER for too long. I remember I was transferred to the PICU.
All right. And up to that point, while you're in the ER and up to the certain event, were you in pain? Were you calm? Were you active? What was your outward manifest?
I was actively in pain, yes.
All right. Were you thrashing or acting out in any way at that point?
At that point, no.
So they took you up to the PICU, and tell the jury what happened then.
When I was transferred to the PICU, I remember my mom came in at some point. The nurses and doctors wanted to put a tube down my nose. And with CRPS, a blood pressure cuff, that hurts. So imagine, like a tube being shoved down your nose into your stomach. And obviously that would have caused so much pain. And I knew my body, I knew I was not going to be able to tolerate that. That is the only time I asked for sedation. I didn't just randomly yell out, I need sedation, like depicted in the medical records. I only asked for sedation when they wanted to do that procedure.
And then, were you given sedation before they tried to put this tube down your nose?
I was not, and my mom was actually in the room, and she listened to the doctors and didn't demand for sedation. Instead, about I would say 2 or 3 people held me down and tried to get the tube down my nose. That is when I was screaming, crying, and thrashing around. I did not curse at any of the staff. That is a lie. But they were not able to get it down, which I suspected because of the pain.
Were you fairly religious? Did you curse as a matter of course as a religious 10-year-old?
I never really cursed. I always thought it was really bad when people did it.
Okay. Later on, you heard that in the hospital, though, from others. But
yes, from staff.
We'll talk about that. Mm-hmm. We'll talk about that in a moment. Now, they tried to do this, and so how did it feel when the doctors or nurses, I guess, held you down? Describe it in more detail. Where did they grab you and how hard they grabbed you, so forth?
Well, it was just like the upper body portion because they were trying to get the tube in my nose. So they were holding on my shoulders and just like my chest area. But again, they were not able to do it. Ultimately, they had to use sedation.
Okay. And I want to ask something right now. Maya, do you have a symptom that while you're up here, you might manifest known as myoclonic jerking?
Yeah, so I don't know if people have noticed this, but normally when I'm sitting in the courtroom and whatnot, I have these like little twitches. It could be anywhere from, my feet to the head. They're kind of random. I'm not doing it on purpose. It's just a symptom of CRPS and it's involuntary. And because I'm not getting my infusions at this point in time, unfortunately, they're going to be getting worse and worse.
Okay. So now you're being held down and you got sedation. What do you recall after that?
Well, I do remember the tube being in my nose. I remember my mom having to leave on a certain day, and this was the last time I talked to her.
Okay. Now, and before I forget, there was, I'm sorry I'm jumping around a little bit. I'll make sure I get to this. Before we go on, by this point, did you know what having a ketamine infusion, the feeling of ketamine inside you was?
Yes.
Were you able to tell throughout this period and after you had started having them with Dr. Kirkpatrick and Dr. Cantu and Dr. Hanna, were you able to tell when your body was receiving ketamine?
Yes.
And how could you tell?
I could tell because the pain level, first off, it was lowered, and there's like a feeling, it's like, I don't know how to explain it, but you could just tell, like, you feel a little bit funny. It's not your normal self.
Okay. And then tell the jury whether, the best of your knowledge and for everything you saw, heard, felt, your mom ever gave you IV ketamine at home?
Never through the IV, no.
How did she give it to you?
It was orally administered, which was okay by the doctor and everything. It tasted a little bit weird, so at one point I asked her to add Gatorade to it, so it's just easier to go down.
But the prescription itself, and if you're aware, great. If you're not, it's okay. The prescription itself, what did it read? Did it say oral? Did it say intravenous? Did it say?
The bottle itself?
Yes.
Yeah, it said intravenous, but it was only for oral purposes.
So you applied out of the bottle to the Gatorade.
Right. Never through the IV.
You never had an IV ketamine at home?
Not at home, no.
All right. So now sorry to jump around. You're back in the hospital, and did they start to examine you? And if so, what happened after that, if you recall? Or do you recall much after you were sedated would be a better question.
No, but I do remember being in the PICU.
All right. And was there anything else that you recall? Was it just one nurse coming in and out, or were there more people there?
In the PICU, you mean?
Yes.
Yeah, I remember, well, because I couldn't walk or anything, I had to have help using the bathroom. And I remember, it's quite embarrassing, but my dad was helping me clean up, and a doctor came in, or so I thought, a doctor, because I knew it looked like a doctor because all of them wear this like white lab coat, and then there's colored squares across their chest. Usually there's like a name embroidered in, but I didn't see that on her. So I assumed she was a doctor. She came in very briefly, and it was awkward because here I am, naked from the bottom down after using the restroom, and she's asking my dad questions, and then she left the room.
And did you subsequently find out who that was?
Later, I found out it was Sally Smith.
Did anyone from the hospital differentiate Sally Smith from any of the other doctors that you were seeing that day?
Absolutely not.
Did Dr. Smith explain her role in any way?
Never.
And did she question your dad? And I don't know about you, but did she question you or your dad about symptoms and history?
She actually believing her overall.
No, I do not recall that.
Now, after Dr. Smith, then, was your mom telling the doctors? Do you recall who was in there at that time, the doctor-wise? If you don't, sorry.
I don't know their names, sorry.
Mm-hmm. Man, female, male?
It was usually more than one, but sometimes they came in individually, and it was mixed gender.
All right. And so was your mom explaining the symptoms? And
she always did. I mean, that was pretty routine. She had to do that for almost every visit.
Was your mom worried from what you could tell, or excited? How would you describe her?
Well, she was definitely worried about her kid, and we had just moved to Florida, and I don't know if you know, but there was a hurricane during this time, so I think everyone was kind of on edge.
Mm-hmm. Did you learn at that time or subsequently why you went to Johns Hopkins as opposed to other hospitals? Or, well, there was a Johns Hopkins in Sarasota, wasn't there?
I don't know. but it was a distance thing. We were staying at the Ronald McDonald House
Oh, okay.
because at the time it was easier to get to my infusion place with Dr. Hannah rather than driving from Venice to wherever he was located. And it just so happened that the Ronald McDonald House is very close to Johns Hopkins All Children's Hospital.
So you're on campus, in other words, at Johns Hopkins?
Yeah, pretty close.
All right. And so your mom told them about the symptoms. Do you recall them questioning you at all about your symptoms?
No.
So what happened after that, to the best of your knowledge? Did you stay up, go to sleep? What?
Well, like I said, there wasn't ever a specific time where I saw the doctors and nurses ask my mom to leave. It was only because this was the day that she had to go to work, and that was my last conversation with her. Whereas with my dad, I vividly remember people coming in and telling him that this was his last time to say goodbye to me.
So was this the last time you saw your mom?
The last time I saw my mom, my dad wasn't there. I was laying in the bed.
This was while you're in your room. Did you get back
Still
up?
in the PICU.
Still in the PICU?
Still in the PICU, yes.
So this is pretty close to when you checked in?
Yes,
Got admitted?
yes. I know I was still in the PICU. My mom was like picking up her work bag and just like little things she had brought to the hospital, and she said, "I love you and I'll see you tomorrow." And I never saw her again.
Need some water? I noticed you're wearing a necklace. Why don't you explain that?
Yeah, so December 10th was my birthday. I turned 11, and I was unfortunately still in the hospital at the time. And the hospital has this program where they collect funds for children who are still in the hospital on their birthday. I was given $20 to spend. And I remember the social worker came in, and she asked me what I'd like to buy. I bought a Nerf gun for my brother. I bought my mom a necklace, and then I bought my dad his favorite bag of mints because I didn't have a lot of money left over. But then my Aunt Wendy bought him this little glass Christmas tree, and we just said it was for me. But I bought my mom this very specific necklace that says "I love you" to the moon and back. It's just like she always said that to me. And then I found out later that she wore it every single day, and when she was found in the garage, she was still wearing it. And I have it on my neck right now.
Have some water.
Sorry.
We'll get through it. Can we publish 2571-001? We're going to switch for a second there, Mike, and ask you about obvious symptoms at the time of your admission. Now, the record reflects it. This is October 8th, 2016, so this would have been the day after you came in?
Yes.
And was this a Friday, and then this one would have been on a Saturday?
Correct.
All right. And what is that there?
It's a lesion, and again, the same thing. It's just smaller ones connecting.
Okay. Now, since that time, have you had the opportunity to review some of the Johns Hopkins records that were supposed to be documenting your condition here and there?
Yes.
All right. Let's show 1001-2645, and I'll represent for the record. It'll show it's the skin assessment for that same day. Let's look for 8 here. All right, so it's got one circular red scab and one circular pink,
Yes.
but nothing else about the other lesions on your body?
Correct.
Did you have one on your back or not?
I had one on my back, but I also had them in other areas, which they failed to document.
All right. So the ones they're talking about here, and this can be confusing, they're talking about the one on your back, or did they ever talk about the one on your legs?
They never-
The ones on your legs.
Yeah, no, they didn't. Not on that date.
Okay. Let's continue then. So you begin your stay there. Were your mom and dad able to come see you in your room at this time?
At this time, yes.
Okay. Your dad. Okay. And then tell us about the rooms you stayed in during this period of time, October, November, December of 2016. Regular hospital rooms?
So first the emergency room, then the PICU. The most distinguishing thing about the PICU, even though every room kind of has it, is the circular clock. And And I remember that because that's all I looked at for days, and I just heard it tick because I didn't have the strength to watch anything on the TV. And then when I was moved up from the PICU to a different floor, I believe it was 7, I stayed on 7 a lot. I had multiple different rooms, even though the policy is every 30 days you switch a room. I stayed there over 90 days, but I had way more than 3 rooms. And these rooms had surveillance cameras. And when I was placed in those rooms with the surveillance cameras, I was told that to not worry about them, they don't work.
So now, if we could, there's been allegations here that you were outside your room 95% of the time. Can you tell the jury whether that's true?
That's not true at all. Most of the time I was in my room. There were times where I went to PT, which I was outside my room, and there was a few occasions where I went to the rec room. But for, I would say, the majority of my time, I was kept in my room.
And did the rooms have the kids that were there, their names on the door or next to the door?
So at one point, I started to get wheeled out into the hallways and whatnot, and that's when I was going to PT or the rec room. Uh-huh. And I noticed something really weird was that all the other rooms on the floor, they had name tags. It would say the patient's name and just the last initial. Whereas with mine, I just had a sheet of paper in there with color-coded stickers. I asked the nurses what the color corresponded to and what that meant and why I didn't have a name, and they would not tell me. I asked multiple nurses, and all of them said, I can't tell you.
During this period of time, do you recall an instance where your mom was trying to get in touch with you and the nurse said something different than just simply putting it through to you?
Which instance?
Was there a time during this period, this first week or so, mm-hmm. when your mom called for you and you did not receive the call but overheard what was said?
Yes. So I remember that my mom was on this phone call, and the person who she was speaking to, a person at the hospital, I'm not sure what role they had, but they claimed that I never asked to speak to my mom. I was doing fine. I was okay in my room. I hadn't had any questions about why my parents weren't allowed to see me. And that infuriated me so much because all I did for days on end was demand to speak to my parents. That's all I wanted to do. And I most certainly wasn't just sitting in my room. I was crying.
So now, were there other kids on the floor? I mean, were there,
yes.
Somebody to talk to, somebody you could, for lack of a better term, play with?
Well, it's a children's hospital, so there's plenty of kids all around. I went to the rec room. So for people who don't know what that is, it's just like a playroom. You could do activities. There's volunteers there. So I remember going down there, nurse wheeled me down. Uh-huh. And I was just working on some art project. I don't remember what, but this really sweet social girl, she came over to me and she just started talking to me.
How old would you think?
She looked around my age, I would say, or maybe a little bit, actually younger. Sorry, my bad. Younger for certain. And her mom noticed that she came over to me a lot and was talking to me. Come to find out, we were on the same floor. I was on 7. And I saw her out in the hallway one day and I asked the nurse to wheel me out. So the nurse wheeled me out. She brought me to the area. So there's like this, on the floor, there's this huge window where you could see outside of the hospital. So you could see like the street and all the cars passing by. And there's a little chair that faces this window. So people who just wanted like a change of scenery could go over there. So her mom was there with Natalie, the friend that I had made, and I was wheeled over there and I talked to them. Another nurse observed this interaction and quickly told somebody. Next thing I know, Kathy Beatty is in my room saying I'm not to ever speak to a patient again. And that day, Natalie had given me this little present because her mom noticed my parents were never with me. I think they just wanted to comfort me, and I have it in my bag today.
Did they ever give you any reason why you, as a 10-year-old, couldn't just talk to the kid next door, for lack of a better term?
I have no reason. I mean, they didn't give me any reason, and it was heartbreaking because, they had my door open a lot, and the blinds were open, so I could see other people conversing and interacting, and here I am, all alone.
Mm-hmm. Now, were they, at this time, paying a lot of attention to your symptoms, discussing your symptoms with you?
Even though I told them about my symptoms and I pointed them out, it didn't matter. They kind of just ignored them.
Before we go further, I think what I want to do, if we can pull up 2003-001, the All Children's Health System, a summary of Florida patients' Bill of Rights and Responsibilities, if we could. So, Maya, were you aware of any of this at the time, or did you become aware of these later?
I was not made aware of them within the hospital. I wish I would have known them.
All right. So you had a right, I'll just paraphrase, to courtesy and respect. Is that right?
Correct.
And individual dignity and protection of your privacy. Is that
Correct.
right? A prompt and reasonable response to questions and requests for you. Tell me about the bathroom.
I just object to leaving on these lines of questions. Overruled.
Tell me about trying to go to the bathroom during this period. What did you have to do to get to the bathroom?
So with the whole bathroom situation, obviously I was not able to walk and I couldn't push my wheelchair at this time. So the nurses helped me, which was totally cool. But it's when the showering happened where it was really weird. So I had to have the door open and they would have to watch me because they were afraid that I would cut myself. I wasn't allowed to have a razor. Later, I was able to have a razor to shave my legs, but I just never felt good about myself.
And it says here, a patient has the right to know who's providing services and who's responsible for your care. Was it ever explained to you who was the person, other than Kathy Beatty, most responsible for your care?
No.
And so it says that you have a right to know what rules and regulations apply to your conduct. Did anybody discuss that with you ever?
No.
Were you ever shown any of these rules and regulations or rights?
No.
All right. Did you receive any information from the Johns Hopkins nurses or the doctors when they visited you about what diagnosis and what their plan was for you?
So they never told me straight up. They never said, we think you have conversion disorder. They never said, we think your mom has Munchausen by proxy. Instead, they would give me little clues in the things that they were saying. So for example, when I expressed to them a symptom or my pain, they would say, no, you're making it up or it's in your head. And then at one point, the social worker, Kathy Beatty, said that my mom was in a mental institution, making me think that something was wrong with her. And I asked my dad and it turned out to be a lie. So they were trying to even manipulate me into thinking that my mom was sick and therefore making me sick, even though it wasn't true.
Well, as the allegations of Munchausen by proxy, which are that your mom or dad are intentionally trying to keep you sick, did any of the doctors or nurses ever simply ask you about your relationship with your mom and dad?
No, and as a matter of fact, they always told me what went down in my house. Dr. Elliott, he said that my mom was putting me in a coma every single week, and I told him no. But even though I told him no, he wouldn't accept that as an answer.
Did they seem to have their own story they wanted told?
Absolutely, no doubt about that.
And so then it says a patient has a right to refuse any treatment. Were you ever given any right to accept or reject the physical therapy?
No.
What was the problem with that as time went on with the physical therapy?
So even though physical therapy, done in a certain way, does help CRPS, when you don't listen to the patient, it's actually going to be more harmful than beneficial. So my condition just went downhill. I mean, when I got back home after being released, it was nasty.
Well, I got to ask you now, there's been some testimony about withdrawal. Did you ever experience, do you know what withdrawal is from a drug?
Yeah, I've heard
Did you
about
know?
it in school, yeah.
Okay. And remembering back and knowing now, did you ever have any feelings after ketamine was stopped for a period of time of withdrawal?
No, ketamine for me was stopped multiple times and for sometimes weeks, and I've never identified with the symptoms of withdrawal.
All right. So no sniffling and anxiety and runny nose and severe headaches and all that? None of that? So did they ever come to you and tell you that they thought you needed to stay there because you needed to be weaned off of ketamine?
They have never told me that.
Right. It goes down there and it says, about two-thirds of the way down, patient has a right to impartial access to medical treatment or accommodations regardless of race, sex, gender, identity, sexual orientation, national origin, religion, creed, handicap. You see that?
Yes.
All right. So tell the jury now first as to being Polish. What does the term mamusha mean? If I'm pronouncing it correctly?
Yes, you are.
I'd like to approach on this. I object. I'd like to approach on this.
Okay. So now, what were you told about your ability to practice your religion in the hospital? What did they say about it?
They thought my mom was controlling me through religion, so they were really against me praying and doing that sort of thing. But
What would they do if you tried to pray with your mom over the phone?
they would shut it down.
So what about a priest? Now, you had a priest from your church that you were comfortable with?
Yes.
Parish? And who was that?
That was Father Jack.
Okay. And tell us about visits from Father Jack.
So he was able to, I remember 2 distinctive visits. The first one was an attempt to give me the communion, and we just chat a little bit. And then the second time I remember seeing him is when he came to help my dad announce my mom's passing.
So were you allowed regular access to Father Jack?
Oh, no. Mm-mm.
Right. Now, as this was going on, these first couple of months there, did you, even though you're only 10, did you have an inkling of why they were doing this bizarre behavior?
Objection, Your Honor.
Strike it, this behavior.
Still objection again to vague.
Let's be more specific.
Right, during this period of time, what, if anything, made you suspicious, and what were you suspicious of?
It was normally the comments that they made or the restrictions that they placed on me and not the other kids. Again, they never directly told me what was going on, even though I asked. So I had to figure it out for myself, and it did take time until I had a general understanding of what was taking place.
And what was taking place, Maya?
I was stripped from my family.
They did not want you to go back to your family?
No.
And was this told to you in some form by Miss Beatty?
She made a lot of comments, especially about my mom. She was the one who came up with a mental institution comment. She also had a lot of ideas of where I should be placed.
All right. And what was she suggesting for you as a place that they would place you?
So I remember this one instance when she came into my room. She asked if she could sit on the end of my bed, and I told her yes. She sat down, and she told me that they were discussing in court the idea of foster care and placing me in a home. She cautioned me, this is word from word what she said, foster care is nothing like it is in the movies. She said that, and then after saying that, she suggested that she take me in and she would be my foster parent.
Let's pull up 10013796. All right, this is in evidence. Let the record reflect from November 2nd. And so was it at or around the time reflected here that Ms. Beatty was initiating you into this concept that you would never go back to your parents, you would go to a foster family?
Objection, Your Honor. Argument.
Overruled.
I would say so, yes. I don't know the exact date that she told me, but I know it corresponded to I'm assuming, because she said it was a court hearing about foster care, and that's where she got the idea.
Now, this is psychology progress notes. Let's talk about that for a second. When you came in, were you seen by a psychologist to be given some testing?
At the hospital?
Mm-hmm.
I later found that out, yes.
All right. Well, tell us who did that, if you don't recall.
I believe his name is Dr. Lewis. Is that the one you're talking? Okay.
Mhm.
Yes, I do remember that whole instance. I was wheeled into a separate room, and Dr. Lewis was in there with paper and pen and a bunch of tests. I did not want to be there. That day in particular, I was in more pain than usual. So much so, I actually could not complete all of the tests. I complained of my hand hurting. And then the nurse who wheeled me there, when she came to pick me up, I was in tears and I was crying.
Well, subsequent to, did Dr. Lewis engage you in any analysis or conversation like analysis?
I remember some of the things we talked about. He asked about my family. He asked about, he regularly put words in my mouth. He tried to get me to agree to things, and I would tell him, no, that's not true. And yet he wrote it down on the piece of paper.
Did you ever see his report?
Yes, and again, it's very frustrating because here you're going to a health, like a professional health place, and you have adults lying about what a child is saying. It's a whole nother level of messed up. It's just so unbelievably insane.
Did you find out whether he worked for the hospital or whether he was working for DCF at the time?
He never told me.
In terms of psychological counseling now, do you know who Dr. Katzenstein is?
I do.
How often would you meet with Dr. Katzenstein, if at all?
I think I relayed some information to Dr. Katzenstein, but I don't remember seeing them regularly.
Okay. And in the visits that you remember, what happened? Tell us a little bit about them.
I remember relaying some information to the doctor, but I don't remember the visits themselves because, again, I don't really remember them happening.
I want to go back to Dr. Lewis again. So there were all these statements in that report about things you said. How did those appear in there?
He was the one suggesting that narrative, trying to get me to agree. And even though I did not agree, he still wrote it down as if I did.
Did this add to your suspicion of what was going on here?
It did, because I've been to hospitals before and nothing like that had ever happened.
Okay. Can you tell us whether you had constant psychotherapy or whether it was limited or next to none?
It was next to none. I don't remember that happening regularly. There was a lot of PT, though.
Okay. Now, do you remember a time when you were put into a room and told you could not leave for some reason?
Are you referring to the
48 hours?
Yes. Yes, I was told about that.
Tell the jury what happened then.
So I was told it was for like a EKG, and I don't know what that is, so I just said, okay. I know now what an EKG is, and what happened in the room was nothing like an EKG. They left me there for 48 hours under surveillance, which they did not tell me about. They had a commode in there, and they just put it far enough away from the bed so I would have to physically stand up and use the bathroom. I called the nurses whenever I had to use the bathroom because obviously I'm not able to walk. And when they refused to help me go to the bathroom, I would defecate on myself.
So let's show 2703-B, a clip from the covert surveillance. Do you know you're being recorded through all this?
No, they never told me.
Continue. Is that it? Is that the end of it? Okay. Now, so you had to have help.
Yes.
And was there any way to reach that commode to relieve yourself without help?
No, not in my condition.
And what would the nurses do when they came in and you had messed your bed?
They would be pretty angry. I had this one nurse, I would call her whenever I had to use the bathroom, and I'm understanding that you have other patients. I get that. She would come into the room, and I'm not even joking. She would yell, 10 more minutes, and then she would storm off. But again, my door's open, the blinds are open. I could see her conversing with the nurses. They have these like little council like areas, and I could see her talking. She was not busy. So I genuinely believe that they just wanted to push me to the limit of like, oh, I'm about to pee myself. I have to get up and stand. But that never happened. Instead, I just peed on myself.
And you were not allowed to leave this room for 2 to 48 hours?
No.
And you would have left if you could?
I wish I could have.
So they kept you in there against your will?
Correct.
All right, let's take a look at 21-116, a series of text messages at around this time regarding this particular visit. And if we could move to the
Judge, again, we object the foundation and through this witness, these are not her text messages.
Overruled. You may proceed.
So, next page. Can you highlight it? Get to the part and highlight it with
the description.
All right, there you go. There you go. Can we? Yes, it's 005 we're on right now. So
This is with Dr. Dees and Dr. Sally Smith. Now, it says here something about pushing several feet in your wheelchair. Does CRPS involve paralysis?
No, it does not. There are some patients with pain so severe that they might not be able to move their limb, but that wasn't the case for me. I was still able to move my limbs. Obviously, I had my days, but I've never had paralysis. That's not associated with CRPS at all.
But that's what they were concentrating on, was whether you could move around or not?
Right. So even though I explained to them that the symptoms vary, that's just the nature of CRPS. For some reason, they couldn't understand that.
All right. So I think there's another one here from Dr. Smith replying to this.
Yeah, one second.
it talks here about you being 10 and not being able to perform this charade effectively. Were you keeping up a charade, Maya?
Not at all.
And did anyone ever come into you, thinking back to the patient's rights, and explain to you that they were concerned that you were making all this up?
No, they never told me that, but they did tell me frequently that it was all in my head. So they just planted the idea there instead of questioning me about it.
Now, and at 10 years old, I know you're very intelligent for a 10-year-old, but were you equipped to try to outsmart or outthink or whatever these doctors at this point?
Do that to a doctor. I had an illness and that's what it was.
Thank you. Thank you. All right. Now, there was a part of I forgot an event here. So I have Nick. So it talks here in your rights about being able to have another doctor or specialist outside the hospital see you. Was there an attempt, to the best of your knowledge, to have Dr. Hanna come see you?
In December?
At any time?
I don't remember that. I know eventually down the line I was able to see him, but I was not made aware of any attempt for him to come to the hospital.
Okay, so this was outside the hospital when you saw
Correct.
it. So during your time in the hospital, was any doctor outside of Johns Hopkins allowed to come in and examine you?
No.
Okay, now I want to pull up 2703-A and ask you, were your CRPS lesions prominent by this point?
Yes.
And did you from time to time ask the nurses to give you something to help them?
I did. I was without my special lotion that I was prescribed back at home with the lesions. And here I just requested Aquaphor because I believed it was the next best thing. Yeah, here I'm showing where all my lesions are.
How, if you know, let's get finished with it here. Keep going. Is this pretty much what you did all day long? Sit in that
Yes.
bed?
Yeah. That's why all my belongings are on it.
So you applied your own salve to them. Did it help?
No.
Did you tell them it was painful?
I was explaining that to her, yes.
So what was the hospital doing to help you deal with painful lesions?
Well, they gave me Aquaphor, but again, it doesn't really do much for them.
Were any of these nurses ever nice to you?
I had a few nurses that were nice, but I could tell that they were all agenda-driven. Like the whole Meghan Trainor incident. I don't know if you want me to explain that now, but
I'm going to get to that right
Okay.
after we talk just a second about how they're documenting this. So let's pull up, like you were just applying to all your stuff, so all your CRPS lesions.
Mhm.
All right, let's pull up 1001-2643 and let the record reflect that's a skin assessment for that day. And if we could focus there on a particular day. Actually, any day around there. Is there even one for that day? Come on in. Where's the 19th? Can you see anywhere where, after all that, they documented on your skin report any of these lesions?
even though I told them about them, they did not document them, trying to fit the narrative that I was making it up.
Let's also then take a look at 2571-014. And for the record, I think this is a photo of your thumb. That looks like a pretty small one.
Yeah, it's just starting out.
Okay. How did they progress, by the way? They start like that, and then what happens?
Normally, without treatment, they do tend to get bigger and they are open to the air. They could be on any part of the body, even non-effective areas of CRPS.
Could you have lesions on other parts of your body as of this date, November 25th, 2016?
Yes.
Okay. Then let's take a look with, I believe, 1001-2640 and 41 to see whether that was documented. So that's what's on the. Do you see anywhere where they are documenting any of your lesions on this?
No.
All right. Let's look at 2571-008 and see what that one says. That's not it. I think is it 2571-3013? Yes. All right. 2571-013. All right. What's going on here, Maya?
Well, first off, you could see the discoloration of my skin, which is a symptom of CRPS. And then you have some small lesions starting out, but they're getting bigger.
All right. Now,
And you could still see the dystonia. Sorry, I just wanted to point that out.
All right. So let's then compare that to the skin assessment for that day if you've got it. I think it's 1001-2640. And yeah, I think so. Is that it? There's a lot of paper. Look here and see that day. Okay. Did they note anywhere that you had this discoloration and lesions?
No.
All right, let's look at 2571-026. Or did I just do that one? No, I did not do that one yet. Bring that up. And for the record, this is December 22nd, 2016. We can focus in on your forehead. Did you get them on your forehead too?
Yes, I got them pretty much everywhere. So I have one on my forehead, and then on my left knee, I have one.
Okay, can we see the left knee then? Okay, all right. Now, can we compare that to 1001-2637? See if they documented it. Okay. You see anywhere where they're documenting the fact that you're continuing to have lesions? All right, and then 2571-030. No, I'm sorry, is that, we just did that one, sorry. 2571-040. Is that the same lesion now getting worse?
Yes.
All right, and do we have the skin report for that day?
No, go to 2571-042.
All right.
That's the 30th now.
All right, that's on December 30th. So what's happening with this lesion? Why isn't it healing?
That's pretty standard for CRPS lesions. Normally when you have a cut, it goes away relatively quickly, but with CRPS, it takes a lot longer to heal. And then also on my hands, I have them again.
All right, so now, and if we have it, the skin report, but I don't know if we have a skin report.
1001 456. 1001 456. Bottom of the page.
Yeah, let's see. So here you are describing burning pain, you're in pain and depressed, and that increases movement. And they're worried about your skinny jeans. When could you wear your skinny jeans?
I don't know what they're talking about.
Skinny
Honestly,
jeans.
I don't remember having skinny jeans in the hospital. In all of the pictures, I'm wearing shorts, so.
Okay. She also reported she now has RSD, CRPS, skin lesions in her hands and forehead. That says they're the usual lesions. What is the date of this? This is December 30th, 2016. We've been through now 2 months of lesions.
Go to the top of that page.
Yep.
Top of the next page, I believe. She does not let me examine. Self-inflicted excoriations. Do you even know what a self-inflicted excoriation is, Maya?
No, at the time I had no idea what that meant. But again, the doctors were telling me it was all my fault. I was doing this to myself.
Well, did they ever ask you whether you were self-inflicting these lesions?
They just told me. They never asked. And then when they told me and accused me of self-inflicting the lesions, I told them no, it's just part of the CRPS.
Are we on 2116, page 001? So this whole time they were not documenting your lesions other than to say that now you're scratching yourself?
Correct.
Okay. Here's a series of, I believe, texts, messages back and forth. And if we could focus on one. Were they suspicious of your mom and dad at this time?
Yes, so there was this whole ordeal with Kathy assuming that I was emailing my mom. So my teacher, Jackie Dieter, she came over to the hospital and I was given a laptop for school purposes exclusively. And most people don't know this, but with the school email, so I only had a school email, which is like your N number, which is what you use to log in, and then it's whatever school, county you're at, .net. So I could only send emails to people within the school district. That meant teachers and students. That is it. I could not receive any external emails. As a matter of fact, the whole system itself blocks external emails, and you cannot send external emails to people outside of the system. Again, it blocks it. It will not let you. So there was this nurse who was in my room when I was on my computer trying to do homework in school, and she noticed that I was on the email portion of the platform. She immediately went, grabbed Kathy, told Kathy I was probably trying to contact my mom. Kathy came back into the room. She said that I can no longer have my computer because she was in fear that I was browsing sex websites.
Did you know what a sex website was at 10 years old?
I didn't even know what sex was.
Apparently she was introducing this concept.
Yes.
So let's talk about your relationship with Kathy B. Was she there on just one floor, so that if you switch from one floor to the next floor, you got somebody new?
So it's pretty standard practice that whenever you move floors, there's a social worker per floor. But weirdly enough, Kathy Beatty literally followed me wherever I went.
So from the time assigned to the end, she was there.
Yes.
Okay. And how would you describe her interest in you? Was it the normal interest of a nurse or social worker, or was it something? What, if anything, was unusual about Kathy Beatty's approach to you?
I
Overall.
have a lot of stories about Kathy Beatty, so it's going to take some time to go through them all. But there was the whole chapel incident where a nurse wheeled me down to the first floor where the chapel is located. The nurse left when Kathy Beatty approached me. Kathy Beatty then kissed me, said, "I'm not trying to be your mother, but I can be." Then she wheeled me into the chapel, and at this point, I was so excited to finally be able to go to the chapel, and she just destroyed all of my excitement. She picks me up, puts me on her lap. She sits in this tan chair at the back of the chapel. There's a photo of that. And she just sat with me there, and then I told her I was done praying. I was very quick in there because I just wanted to go back to my room. And then I was put back into my room. There's many instances, numerous occasions, that she lifted me up and put me on her lap. She clawed through my hair. I was close enough to her, almost at all times, to the point where I knew she had permanent eyeliner. That's not something unless you're really close to a person. She would tell me weird details about her life. Yeah.
Let's show 2597-18. I believe this is a photo of the chapel. And were you ever curious as to why she had you in the chapel?
So one really interesting thing about the chapel is there's no cameras. It's the only place.
Were you uncomfortable with Kathy Beatty's advances on you?
Objection, Your Honor. Argumentative.
Sustained.
Did these incidents with Kathy Beatty, were they upsetting to you?
Yes,
Did they cause you to fear her?
most certainly, and the whole photo incident truly solidified that.
We'll get to that in a moment. And was Kathy Beatty the only one that was tormenting you, if you want to use that term, but during this period of time?
Single objection, argumentative. Overall.
No, there were other people as well. I mean, it was the doctors through their words of accusing my mom and I of certain things, or, well, for me, I guess, accusing me of not having my CRPS. And then there was one nurse in particular, Ashley Sumner, who I had encounters with in the PICU.
So what happened, tell us about the Megan Trainor incident and Nurse Ashley.
Okay, so Nurse Ashley was not, she's independent from the Megan Trainor incident, Ashley Sumner, PICU,
Okay.
and then the Megan Trainor incident was on floor 7.
Okay, well, tell us what happened on floor 7.
Okay, floor 7. So there was at one point where a nurse had come into my room, and she informed me that she had looked me up and knew that I liked Megan Trainor. So I had a public Instagram at the time, and I was only like 10. And so I like posted videos of me like singing and dancing to Megan Trainor, my favorite artist. So I was a little like, I don't know, it put me off that why would like a health professional look up their patient on the internet and proceed to look them up on social media. But I kind of dismissed it until later in the day. She not only came back with herself, but a number of people, I would say like probably 6, 7 nurses and rec workers. They all stood in a line. The one in the middle was next, like in front of my bed, and she was holding a phone camera. And the one next to her was playing a Megan Trainor song called like I Feel Better When I'm Dancing, one of the ones I posted on social media. They were trying to get me to dance and sing and move my extremities in ways that would hurt me. And when I did not move in the way that they wanted me to, or move as vigorously as they wanted me to, they stormed out of my room.
Were they dancing, trying to dance around you?
Yes, they were also trying to like get me to do certain movements, but I was in severe pain, so I was barely moving. I smiled a little bit, I did my best, but ultimately they never ended up showing the video to the court because it didn't fit their narrative.
So they were, from your perspective, what were they trying to get you to do?
I think they were just
I
trying.
apologize for interrupting again, just today.
What's the legal basis?
I'm objecting to mischaracterization foundation.
Overruled. She can answer.
I believe the nurses were trying to make me to look like I was as healthy as possible, that I was living my best life in the hospital. I was listening to Megan Trainor, I was dancing, I was smiling with all the nurses, but that wasn't the case at all.
So it was my mistake. I didn't realize Nurse Ashley was involved in this. Was there an incident with Nurse Ashley where you were hurt?
Yeah, so we have to jump back to the beginning. So this is like October. Once my dad and mom were told to leave, I was obviously left alone. And there's one nurse in particular who I had the most interactions with, and that was Ashley Sumner. There was a point where they were moving me up to floor 7, so that called for a bed change. They regularly have to change the sheets and whatnot, it's like policy. But even though I had told her I cannot walk, I cannot stand, I cannot roll, she threatened me. She said, if you don't move right now, like, what did she say? Or else, that's what she said, or else. If you don't move right now, or else. I remember the or else. And I just started crying because I'm so scared. Like, my parents aren't here. I have nobody that I trust. And this random lady is threatening me. And I can't even perform the movements that she wants me to. So she yelled at me for quite some time, telling me to roll over. I know you can move. I know you're faking it. Just stand up. We all know. Eventually, she gave up because I could not do what she wanted me to do. She went out in the hallway, grabbed about 3, 4 nurses. They lifted me up by the sheet of the bed itself to transfer me, and she dropped my arm really hard in the bed. Now, that's insignificant to most people, but to a person with CRPS, it's like falling on concrete. Like, it hurt so bad. I remember the feeling just in my body. It was so painful, and I just cried. She was just awful, and I don't know. I'll never forget her.
All right. Getting back to Ms. Beatty then, do you like chocolate cake?
I do, and I ordered that almost every night at the hospital.
All right. Did Kathy Beatty know that you liked chocolate cake?
Yes. Yep.
Was there an incident where that was held out as a prize or something?
Yeah, so in PT, as my stay went on, they wanted me to improve, but because of their system of doing it, it hurt my CRPS, so I wasn't making the improvements that were typical of other patients that are non-CRPSers. So she thought that bribing me would maybe spark some more motivation for me to start doing different things. On one instance, she said that she would bake me a chocolate cake if I did well in PT. So I tried my best and I overexerted myself because the thought of just having something that was non-hospital food for the first time was enough motivation for me to, risk putting myself in more pain. So after the therapy session, I asked her if I could have it, and she said no, because it's Lent. Now, I have to explain this as well. So I'm Catholic, and Lent is a standard practice before Easter. You give up something for 40 days. And, you know, I'm a kid, so I don't really understand the time of when it was supposed to happen. I just knew that Lent was a thing associated with the Catholic religion, and I've done it before. I was in the hospital October, November, December, early January. That's not around Easter. She knew that I was Catholic and that I was so religious that she held the idea of Lent over my head and saying that I couldn't have the chocolate because I gave up chocolate for Lent.
So, what about talking to your mom and dad through this period? Now, was this a frequent thing or an infrequent thing?
You're on that apologize for objecting again, but again, foundation type thing.
Let's be better on the time, but otherwise overruled.
Yes, sir. Yeah, I got it. Good, thanks. So, let's talk about the graduation of.
I'm sorry to cut you off, but there's another story about Kathy and the PT, another bribe, if I could share.
Sure.
Okay.
Absolutely. What happened with? I have to answer the question.
Okay.
What else happened with Ms. Beatty insofar as tempting you to do something?
Again, it was another religious motivation. She told me again, if I try really hard in PT, she will take me to the chapel. Not the chapel in the hospital, but the chapel outside of the hospital, a couple of blocks down. So again, I tried my best. And after the PT session, I asked her, when can we go to the church? And she said, I didn't do well enough.
All right. I want to talk about in October, how often you were able to talk to your mom or dad.
Well, the visits with my dad and my brother, they varied. There was times where I was allowed to have visits with them, and then other times not. And then with my mom, I was allowed phone calls at certain points, and then again not. It was so on and off, I really had no idea of when it was permitted and when it wasn't.
And when you did have the opportunity to speak with your mom, were there any problems with those calls that made it difficult for you to communicate, or your mom to communicate?
There was always a problem.
Like what?
Well, it was always the person who was overseeing the calls, Kathy Beatty, again. She would sit on the edge of my bed, listen in on all the phone calls, and she would limit our conversation to very basic and insignificant things.
So I'm going to publish then 3 clips in evidence. For the record, they're 2608A, B, and C. And you've heard these previously?
Yes.
Is this, best of your knowledge and understanding, Kathy Beatty's voice that we'll hear coming in?
Yes.
If we play A, please.
Okay, I'm recording this phone call so everybody knows.
Okay, hi, Mommy.
Hi, honey. How are you, sweetie pie?
I'm hurting. I miss you.
I miss you so much too. I miss you so much every day, every single day.
You know how happy it makes me feel to hear your voice.
Same here. I miss you so much, and I am so happy that I'm finally able to hear your voice too. Yeah.
I hope I see you.
What did you say, sweetie?
I hope I can see you soon.
I would love to see you soon. I would love to see you soon. We just have to wait for the judge to make the decision, okay? As soon as he makes the decision, then I'll be able to see you. Okay?
Beata?
Yes.
Beata, we're not allowed to talk about the case, okay? Maya, honey, we're going to talk about what you've been doing, if you need any Shopkins or things like that, if you had nice visits with your daddy, but we can't discuss the case, okay, honey?
Was Beatty the only one that would know about those Shopkins?
Yes.
All right.
Because she is actually the one who delivered some of them to me.
When these were going on, what was Kathy Beatty's facial gestures?
So you can't obviously see it on the audio recording, but when I tell you, like every single time I had a conversation with my mom, she'd be rolling her eyes like that, or she'd be making faces or sticking out her tongue. Like she was acting like a toddler.
Let's play B, 2608B.
How you doing? How is PT and OT going for you?
Not good.
Why is it?
Okay, Beata, we can't discuss any of those type of matters, okay?
Okay.
All right, and then 2608C.
And what do you usually need help with?
My pants.
What happens with the pants?
I just can't lift them up.
You can't pull up the pants anymore?
No.
When did that start, Maya?
Oh, I don't know. It was a while ago. I don't know. Like, I don't remember when it started.
Okay.
TBH.
What's PVH?
Yeah, I'm going to redirect that line of conversation now. Thank you.
Okay.
Now, during this period of time, are you aware now that your parents, strike it, are you aware now that through this entire period of time, your parents retain the right to be able to be involved in direct your medical care?
Yes.
So we're trying to, discuss your physical therapy here?
I was trying to tell her about it because she asked, but Kathy Beatty put a stop to that.
All right, now, so tell us about the pulling up the pants. And it was good humming. I like the humming part. But why is it important that at this point you could no longer pull up your pants?
So it's showing how my condition, the longer I stay in, the more of the things I was able to do, I'm losing in terms of like my independence.
All right. Okay. And again, were you allowed to use any words of Polish in these conversations?
No, that's why I wasn't.
Mm-hmm. All right. I want to ask you now, did your mom and dad still try to get stuff for you during this period of time? You know, gifts, little things, cheer you up?
Yeah.
Did there come a time that they bought you a dress you always wanted, a more formal dress?
Yeah, so this was pre John Hopkins All Children's Hospital. We were at the Ellington outlet malls, and we went into Tommy Hilfiger, and there was this really nice dress that I was obsessed with. It's just white, the shoulder it wasn't long sleeve, it was just the width of a dollar bill, and then around it was a navy trim, and then the signature logo was on the breast area.
And so were there attempts made to bring this dress to you while you were at the hospital?
Yes, so my dad was permitted visitation, but everything that to my knowledge, most of the things he gave to me, they had to go through a certain people. And the dress that he had brought, it had to be given to Kathy Beatty before it reached me.
Did the dress ever reach you?
No, and I clarified with my dad because I thought, maybe he didn't know what dress I was talking about, but he was there when I bought it, and I described it to him. He knew exactly what I was talking about. Instead, I got a red dress, but to this day, that dress is probably rotting in Kathy Beatty's office.
Where did it turn out that dress that was not delivered to you, the Hilfiger dress, actually was?
Kathy Beatty had it.
No.
Oh, and I know that because another social worker said she saw it in Kathy Beatty's office.
That's right.
Yeah.
Okay. And so now I want to talk a bit about the day you were supposed to go to a court here, January 6th. Right? So on that day, were you excited?
I was ecstatic. I mean, not only was I getting out of the hospital for a little bit of time, I was going to see my uncle, and the goal was to see the judge.
All right. And were you preparing for it, trying to get yourself ready? And
yeah, I told people in the hospital, the people, the nurses and whatnot, I'm going to court today. I was excited. Yeah.
And so then what happened insofar as trying, what did you have to do before you were allowed to go to the court and see the judge? What happened with Ms. Beatty?
So it was my understanding that I was just allowed to go to court because they ruled on it and I was allowed to come in person. So I was just expecting my uncle was going to come pick me up and Kathy Beatty was going to wheel me down to meet with my uncle and put me in his car. Instead, Kathy Beatty showed up in my room a little bit earlier than the time I was supposed to go. She came in alone initially, and she told me that if I wanted to go and see my mom in court, I was going to have to be stripped naked and photographed by her nude so I could go to court. I cried and cried because I'm a very modest and private person when it comes to stuff like that. I have been, and there's a reason for that. I really respect my privacy. And eventually I was able to reason with Kathy, and she said that I could keep my training bra on and my shorts. That's when she left the room. She came back with Nurse Alicia. I don't know her last name, but she came in and she assisted with holding me down and moving me and removing some articles of my clothing for the photos. Now, the purpose for these photos, typically, DCF takes them. DCF did not take these, and there's supposed to be a side-by-side comparison of pre-visit and post-visit. So I was leaving the hospital, so they took the photos before. There was never photos taken after.
And has it come to your attention that this did not end up in any analysis in the medical records or anything like that?
That's another thing I was promised in the whole reasoning with Kathy about not being nude. She told me that I could keep my shorts on in the training bra, and I specifically asked her to keep these photos private. I asked her if they were just going to be in the medical record, and she told me, yes, only doctors can see them. She actually physically went over to the computer where I've seen nurses and doctors put in information, and turns out she never put the photos in there.
All right, so let's turn to, first I'm going to publish a photo, 2604. Now, were you actively trying to keep them from taking off your clothes? No, that's not it. There.
Yes, so that, you see my hands right there, and then someone else's hand, I can't tell if that's Kathy's or the nurse's, but I was trying to pull up my shirt actively as she was pulling it down.
All right. And around this time, where we go into a few more photos, did you document this in your MyCare journal?
I believe I did. I haven't seen the MyCare journal in quite some time, so I would need my memory refreshed.
Let's look at this photo here. Now, it has been portrayed that you were somehow enjoying this and just holding hands. Tell the jury what was going on.
I was not enjoying this at all. It is true, when the nurse came back into the room, I wasn't crying as much because Kathy had calmed me down after we made that, agreement. We met in the middle. But you can see my cheeks are red, and that happens a lot when I've been crying.
Okay, and we can see a little corner of your mouth there. Are you smiling, grimacing, or what?
I am most definitely not smiling.
Okay. And is that a training bra?
It is.
Now, was there a time that you had to switch out of one bra to another?
Yes, so they're trying to maintain the position that, I was in a training bra and shorts, like we didn't, see anything. No, Kathy watched as I got naked because I was changing into clothes for court. That's why there's two different outfits. This was the same time period. There was no before and after photos.
All right. Let's look at 2604-15. There you are, blue shorts. Now tell us about the shorts. Did you remain in the same outfit during this ordeal?
No, because I was changing into court clothes.
Okay. So which are these, the blue shorts there? That's
I don't know which outfit I ended up wearing to court, but
okay. And then let's look at 2-3. Oh no, we're going through these. Let's go through these. And now what is that? What kind of bra is that?
That's a training bra again.
Which came first, the training bra or the those are both training bras?
Both are training bras, correct? They switched them out.
So this wasn't a workout bra or anything?
No.
Bras. And did you tell them while were they holding you down through much of this?
Yes, and some of the photos you could see their hand, but it looks like the photos are mostly zoomed in, so you can't see their hand placement.
Did you want to leave and get out of there?
Yes.
And were they preventing you from getting out of there?
They were until the photos were completed.
And did you have any control or ability to get out of there?
No,
physically?
Because I couldn't walk or stand.
And this was against your will?
Correct.
All right, let's look at the 2-3-6-4, unless there's more of these we want to go through.
That's good.
You got them?
That's it. So,
Yeah, I got it. Okay. I wasn't going to cover it, but we will. So let's, what was your relationship with Alicia, the nurse that was in there before this?
So I had seen her before and I recognized her, and my first encounter with her, I trusted her. I had no reason to doubt her as, a healthcare professional. Actually, here in the MyCare journal, I wrote her name. And the second time I saw her, she was assisting Kathy Beatty in photographing me and changing me in front of Kathy Beatty.
Let's look at 23-64-009.
that's it.
Is this it? All right, so she's right there. All right.
And so how did you react when you saw that Alicia was now one of the people holding you down?
It was another complete breach of my trust.
Did you feel betrayed?
Absolutely. I felt betrayed in that hospital almost every day.
Fine. Now, I want to talk for a moment. I think we've gone over the necklace that you still wear. How did you learn about your mom's suicide? And tell us the first time you felt that this may have happened.
Oh, yeah, that's an interesting story. So, on the 7th, I'll never forget, January 7th, I couldn't sleep. Again, it was a combination of just pain and, my depression from being isolated from my family. So I was up until 2 in the morning. And I swear to God, I am not making this up, at 2 in the morning, I broke out in tears. I was just crying uncontrollably. And I called the nurse in, and I told her, this was a nurse that I actually had a pretty good relationship with, and I told her, I miss my mom, I miss my mom. I love my mom, I want to go home to my mom. Turns out she ended her life.
Was that around that time that
Yeah.
you did? Okay.
That's why I always say that it was really January 8th that she died, not the 7th, because I just have this feeling that it was then.
You felt it?
Mm-hmm.
All right. So how did they go about telling you that your mom was gone?
So I had a visit with my Aunt Wendy, I want to say maybe the day after or so.
Uh-huh.
So this was the 8th now. And something was off with her. And I asked her what's wrong. And she said, I don't know, just something happened earlier today. Sorry. So she didn't end up telling me then. I just enjoyed the rest of my visit with her as usual. And I'm not sure if it was that evening that my dad came in with my brother and Father Jack, but I know it was sometime close to January 8th. And I was sat down on the couch. My dad was I think I was maybe I wasn't in a wheelchair, maybe I was on the couch. My dad may have lifted me and put me on the couch, so I'm not sure about that specific detail. But my dad was right next to me, and right next to my dad was Kyle. In front of me was Father Jack. My dad said he had some bad news. And weirdly enough, the first thing I thought of was they're not going to let me home, or that I was going to be put in foster care. And it turned out to be even worse than that. My mom had died. So I was told that, and immediately after my dad had to leave.
Okay. How long was your family allowed in there to tell you that your mom had passed?
It wasn't a lot of time, if I'm being completely honest. It was actually so unbelievably cruel, the amount of time they allocated for me to spend with my family after hearing such awful news.
So after this now, if your mom was supposed to be the reason why here with this Munchausen thing, and your mom's gone, did they let you go?
Objection. I'd like to approach on this one.
All right, we are going to pause here with Maya's testimony, and we're going to switch over to Dr. Kilpatrick's testimony. I think that's going to be a key testimony to hear in terms of her diagnosis, since he's one of the ones that initially diagnosed her and gave her the ketamine treatments and suggested it and all that. There's been a lot of different doctors at the hospital that were took the stand as well, but I just feel that this one is going to be particularly interesting in that to kind of hear where his mindset was from it, because my mind personally goes back and forth as far as it's good that he was able to find a diagnosis for her and to treat that. But when I first heard of the ketamine treatment that she was receiving, it did sound intense, and it did sound pretty out there. So I'm going to be interested to hear kind of what his research was, or his mindset for feeling confident in doing the ketamine treatment, despite many other doctors not feeling comfortable with doing it. And to hear whether we feel, was it was that really the only option left, right? Because again, it seems like one of those things where it's kind of covering up the pain rather than addressing what the deeper issue is.
Up to Maya Kowalski now. These results of the various studies that you performed indicate that ketamine was useful in the treatment of CRPS.
Yes, in the beginning it was not doing what the patients call ketamine coma, being put under general anesthesia for 5 days. It was the low dose conscious sedation. The patient's awake, they can talk to you, but you're giving them ketamine. It's called conscious sedation.
So how did you discover this other procedure involving putting them under anesthesia?
One of the things we learned is that the benefits from the ketamine it's dose related. The higher you get the dose, the longer the response, the more vigorous the response. But there's a limit to how far you can go and still keep the patient conscious. There's going to come a point where you start to lose consciousness. And when that happens, the thing we concern ourselves with is protecting the airway, especially in children. Because children, when you give them ketamine, they tend to salivate a lot. So that saliva we all have is okay in your mouth, but it's got bacteria. It's not so okay if they get into your lungs. We call it aspiration into your lungs, and that can cause pneumonia. So remember, we're talking about conscious sedation. The patient can talk. They don't have a tube, an endotracheal tube, into their trachea to protect from the saliva going into their lungs, but they're awake. Their reflexes keep the saliva into your mouth. It's a protection we all have.
All right. So how did the intubation, general anesthesia, infusions work?
Sure. So to do a research study, you really need numbers. Well, he had some patients there that were. Now we're talking how we progressed. I'm sorry. Is that what your question? How we?
No, I wanted to get across to the jury whether it was effective or not. The procedure, once perfected, whether it worked.
Yeah, it worked. It worked in the vast majority of patients. Conscious sedation with ketamine works. It gets them controls their complex regional pain center. The vast majority of them.
Now, in the studies that you did regarding the general anesthesia, were you under a review board at that time?
Yes, all studies that are clinical in nature, you have to get it done by an institutional review board. And at that time, we decided that it would be done by Drexel University, where he was professor and chairman of the Department of Neurology.
I'm trying.
Sustained.
So, Doctor, now, did you ever have to turn in to the institutional review board any bad results, for lack of a better term, out of this study using the anesthesia infusion?
Never had it right.
Sustained. We need to move on, Mr. Anderson.
Yes, sir. All right. So, Doctor, did you begin private practice in Tampa, St. Pete area, and when?
Oh, well, no, I've been based in Tampa.
Okay.
And so, no, my practice has been primarily in Tampa.
Okay. And so when did you start treating patients in the Tampa Bay area?
That's when I arrived at the University of South Florida. That would put us at about 1988.
Right. And when did you stop actively treating patients as in an anesthesia practice?
Well, I'm still practicing.
Okay. All right. So how did it come about that you met Maya Kowalski?
Okay. From what I understand, the mother, Beata, had heard about me through her contacts. Her mother is an infusionist nurse, and she'd heard from some of the other patients about me, and that at that point in time there had not been a diagnosis, and the family really felt there was something desperately wrong with their child, and they needed another opinion, and they wanted to look at this possibility by consulting with me.
And was your first visit, I know you don't have your records in front of you, was your first visit on September 23rd, 2015 then?
Correct.
So tell the jury what you did on your first, the first visit.
Well, I have a policy, and that policy is that you always tell them how long the evaluation is going to take.
Right.
In a situation like this, it usually takes at least an hour to get through an evaluation. And I tell the patient the first thing I'm going to do is they fill out this we call the new patient information form, and I'm going to go, before I talk to them, I'm going to go over that material and see what I can get, sort of a background, what I'm going to be confronted with.
Now, doctor, when your new patients come in, are you like just trying to confirm that it's CRPS, or are you looking for whatever the diagnosis is, CRPS, or it could be something else?
Well, you have to do the latter. You have to look for everything, because that's part of making the diagnosis. You have to rule out all the other possibilities based on the history, based on the symptoms, based on the signs that you witness. You have to be able to rule out these other potential diagnoses, or at least you can come up with a differential diagnosis may include more than one thing wrong with the patient.
Do you then try to avoid what was known as confirmation bias? That is, everything that comes through the door is presumed to be CRPS until proven different?
Well, confirmation bias. No. Well, you have to fight that.
Right.
You have to fight it. You got to say, I'm here to help the patient. You can't help the patient if you're not can I use the phrase, an honest broker.
Got it.
Okay.
All right. So how did the examination of Maya go?
Well, she was in a lot of pain, and after a while working with children, you kind of learn of a way to communicate, to get them to relax and try to bring it down. At 10 years old, it's a challenge, but it can be done. You can try to get it down so they know that they're part of the discussion with the mother.
Right.
So we work hard to do that. And I also invite the child to be part of the discussion. So the first thing we do is, most time when I look at the new patient information form, it's something like this, and it's incomplete. Mm-hmm. So I'll go through it and I'll fill in the blanks with them as we go through it.
How did Maya appear to you in terms of maturity and intelligence for being 9 or 10?
Remarkable. It's not just intelligent, it's curious. She wanted to know. She's listening to what her mother says. I wish you got a child that's a little unique, different. Right. Not a little, a whole lot different. Mm-hmm. So she's intellectually curious, very much engaged in the conversation.
So did she contribute then in going through and finishing the questionnaire?
Yeah, they both contributed to that process.
All right. So after that, what steps did you take to examine the child?
Well, I have a pretty much a head-to-toe type of examination, because remember what I said. You got to look for all the possibilities here, not just one thing that you've been doing research on. And so the first thing, like I say, I want to take a history. History is very, very important. I mean, the history is very important. So you're looking for, the whole history. Did it come from, how did this start? And then you go and work through all that process. And so you try to fit all that together and see if you can narrow it down a little bit, what's going on. And then, of course, there is the examination that takes place. And there I have a pretty standard thing from head to toe. It doesn't just look at just the one area. And then another thing I do, and this is something that I'm very compulsive about, is I want to set things up and do things that leave me convinced that I've done a very objective evaluation.
And what does that involve?
Well, that involves fighting the tendency to want to be biased. I mean, we always want our patients to do well, right?
Right.
All right. So one of the things I did since I started running the surgery center is I set up a new technology or a new methodology for measuring pain, not by numbers. You've heard this whole thing. Is it a 1? Is it a 2? Is it up to 10? 10 being the worst pain you experience. That's for chronic pain. It's almost useless. For acute pain, it can be helpful. But for chronic pain, in terms of doing research, it's not very helpful. So I wanted to find a way so I could measure, without even talking to the patient, how much pain they're feeling between their earlobes.
And what did you use?
And what I used, I brought it today. I can show you if you want to see. It's a device called an algometer, and what it does, basically, first let me back up a little bit here. When you get CRPS and some other diseases, what happens as time progresses, maybe not initially, the body changes from being a local phenomenon, like you hurt your hand or whatever, sprained an ankle. It tends to progress into the central nervous system and into the whole body, the brain, everything gets involved. There's a word for it. I'm going to throw the word out and then forget it. Hyperesthesia. You'll find it in what they call the Budapest criteria. It's one of the things you're looking for when you do a diagnosis. Hyperesthesia.
All right.
And what that means is that all your senses, touch, sound, hearing, smell, they get accentuated so that you become very sensitive. So it was common for Maya to come in with dark glasses on because the light was bright lights were painful to her. But when she came in, the one thing that stood out more than anything else is her skin was exquisitely sensitive to light touch. Again, I don't want to use the big words for it, but I don't know. I don't know what other people have said.
They've been well educated.
Have they? Because I don't know what other people have said so far, but it's called allodynia. Okay, and it's like defined as any type of tactile stimulation, light touch, blowing on the skin, is perceived as being painful. She had that. She had a bad case of it.
What other symptoms or signs did you know?
Well, she had the allodynia. But the point I want to make is you can touch them and forget. What this technique is called measuring pain thresholds allowed me to not only just detect it, but to quantitate the magnitude of it, of what she's feeling in her brain. And this device, by putting pressure on the skin, it gives you a number. It's called the pain threshold. So I tell the patient, look, I'm going to apply this device to your skin, and it'll feel like pressure. But I'm going to increase the pressure, and when the pressure turns to a pain signal, say stop. And we do it 3 times just for statistical reasons. 3 times we do that, and we get a number. And from that, and oh, by the way, one other thing that's very important: they're blinded. I mean, they don't see the numbers. They don't see nothing. So this is what I mean by being objective. So if a child comes in, let's say, whatever, they want to stay out of school, so they're faking their pain, whatever, I can tell without even talking to the child if they are or not by doing this. The pain thresholds. It's a way to distinguish between what they're feeling in their brain in terms of pain signals as opposed to what's an emotional issue that might be evolving.
What, if any, other signs or symptoms were noteworthy during the initial evaluation?
The other thing that was noted, besides the generalized, the seeing problems and the touch, not just in her legs, but in her arms and so forth, measured with this device,
right,
was the dystonia.
Okay.
Dystonia is when the muscles contract due to the disease. They're curling in. Sometimes they'll actually stretch out, but mostly there's flexion. And it can happen in the hands or in the legs. Yeah. The interesting thing about it is when it comes comparing adults with children, we rarely see it in adults, but we see a lot of it in children. So if a child comes in with dystonia, you got to be thinking about CRPS.
Anything else in terms of signs or symptoms, first from the examination, and then I'll ask you about the history.
Yeah, well, I think in terms of examination, of course, we try to measure temperature of the skin, and we're always comparing one side with the other. When the sympathetic, like I said, I have to go back a little basic. We knew from the very early, 30, 40 years ago, that this is a disease involving the sympathetic nervous system. And usually it's symmetrical on both sides. Your temperature is pretty much the same on both sides. But when you get the CRPS, things get disconnected so that one side may be cold, the other side may be hot. So I took out a device, which I brought today if anybody wants to see it. It's called infrared scanner. And I want objective information. So it measures down to 1/10 of a degree. So I measure for differences in temperature. Now on this particular occasion, there was some difference, but it didn't reach my satisfaction for a significant difference from a medical standpoint. So I didn't record that there was a difference in temperature.
Okay.
Keep in mind that this is a disease that's labile. You come in one day and there's a difference. One side's warmer, one side's colder. If you think about it, there's going to come a point where they're kind of they're the same when they're fluctuating like that.
Any other signs or symptoms from the physical examination
That
you can think of?
From the physical, let's see. Yeah, there were. Yes, on the right side. Now, with this device, I'm able to tell you which side is worse. The algometer. I'm able to tell you which. Her right side was worse with the CRPS, the sensitivity, and she had lesions on that side, and they typically are like they look like little dots almost sometimes, but they sometimes will break up and then they actually become an ulcer where they breaks through the skin.
Right. Okay. And then very, very briefly, the history given, what was significant to you now that you had these physical signs?
Well, for me, there's some things that just glare at you. Hey, this is CRPS, complex regional pain syndrome.
Right.
The main thing is allodynia. There is nothing we know in medicine that causes this exquisite sensitivity to light touch than CRPS. There doesn't exist. Okay, doesn't exist. And so that just right away, that became a very big deal. And of course, like I said, in children, the dystonia when they get CRPS is so common there. So putting it all together, the dystonia, which is a sign, and the which means she couldn't walk. Right. She couldn't put her bare weight.
She was in a wheelchair?
And she was in a wheelchair. Okay. And she had the real sensitive skin, which you couldn't touch in certain areas, especially in her lower extremity, especially on the right side.
Let's jump ahead. So you made the diagnosis of CRPS.
Yes.
And you confirmed it with your testing?
Yes.
And so how did Beata present to you through this initial evaluation, the mom?
Well, it's kind of funny because I was talking about Maya being so intelligent and so inquisitive, and that's her mom. Okay. They have the same DNA.
Yeah.
She's the same way. She wants to know details. She's very medically oriented, and I like that. And to me, it's refreshing to have a patient that gives you a little bit of a challenge. I enjoy that.
Did you find her determined or any other characteristics?
Well, she loved her child. I mean, she loved her child. And you know what? The child loved her mother.
That's always a good thing.
Yeah.
All right. So now you've made the diagnosis. What did you prescribe as the initial, strike that. Did you check to see what different therapies Maya had already been through?
I did. And I looked at particularly those places where she had the usual, customary treatments for CRPS. Physical therapy, maybe occupational therapy, and cognitive behavioral therapy. Those are the big things that you think about in the beginning. And I did think about those, and I did explain to them during the evaluation, our job is to get the legs moving. If we don't get those legs moving, especially what we're looking at right now, it could, well, she asked me what could it be, and I told her the truth. She could form blood clots in her legs, and they could break off, go to her lungs, and it could be fatal. And the problem with that, in children, especially in children, it's a silence. It's silent. It's hard to diagnose because in adults, when we get a pulmonary embolism in our lungs, you get chest pain, you get a feeling of apprehension, something ain't right. Kids, they just don't wake up in the morning. So that's one problem. The second problem is if they do get it, it's hard to treat. Why? Because remember what I said, they have the allodynia in their legs. Normally what we'll do is put them in pressure socks. Their skin is exquisitely sensitive to light touch. So that limits your treatment options in that situation.
So what type of therapy did you suggest or prescribe to start with?
I told her that if she can possibly get into some heated pull exercises, that would be recommended.
And did the Kowalskis follow your prescription, if you will, and find ways to heat up their pool?
Yeah, I understand they set up some kind of a solar system, yeah.
So how long did the warm water therapy last, the best of your knowledge, before they were asking you if there's anything else could be done?
Well, I think they came back and because I don't have the evaluation here in front of me, but they came back, and she had a kind of an exacerbation of her symptoms, and then taking, and this is important, taking in consideration she's exhausted in moving forward with her symptoms and problems medically, with the usual customary treatment, the physical therapy, the PT. And by the way, if they don't know what they're doing, PT can actually make you worse.
Right.
So they tried all those things. In fact, she spent a month, I think it's about a month, at Tapper General Hospital.
That's right.
I know their program because I was there for over 20 years. I think it's 20 years. I was there for over 20 years on the attending staff there.
Yeah.
And I know the program, and that's what it is. And so they've been through all that, the psychotherapy, all that, and she was just getting worse.
So what was the next step for a reasonably prudent physician,
right,
pain physician at this point?
Right. Having had the experience of doing those, over that 2-decade period, we've done a total of probably, we've probably done, be exact, 43 patients with the ketamine coma. I didn't think of that right away. That was not what I thought about. What I thought about was, let's try a low-dose conscious sedation where she's awake. Now, mind you, and this is I explained this to them because her mother asked me, "You said, Dr. Kirkpatrick, that she will lose her memory temporarily, short-term memory. How long does it last?" That's what I mean. That's the kind of mother she is, okay?
Right.
She's asking questions all the time. And it's temporary. But it's important that we give enough ketamine, because remember what I said. It's dose dependent. You have to get the dose up. So we want that temporary loss of memory.
Is that part of the resetting process?
Right, exactly. And so we don't want to get the dose so high for safety reasons that the secretions could end up down in the lungs. So the way we prevent that is they're always conscious. So they do not lose their long-term memory. Who's that over there? Well, what's her name? That's my mother. Or the mother is actually there in the room with the child. That's another thing we found very important. Children, it's really important, kids, to have the significant other there. If it's a mother or father there in the room, because what happens sometimes, they start feeling the room's getting bigger, getting smaller, they get a little frightened. They look, oh, there's the mother over there. Dr. Kirkpatrick isn't trying to poison me. I know who that is. That's my mom. She's here to protect me. Because you do lose your sense of it's got. But kids, we knew this for decades. Kids don't really hallucinate the way adults do. Adults can get really bad hallucination. We rarely see it in kids. Rarely. But nonetheless, the point is the mother's there. And we constantly ask them, what state do you live in? What country do you live in? So we always are communicating back and forth to make sure we don't overshoot.
I'm trying to move along.
Something responsive to a question here?
Yes. Doctor, we'll try to confine the answers a little more to the questions. I know you have a lot to say on this. How many different infusion sessions, if you recall, did Maya go through? The outpatient type, if you will.
Yeah, there were 4, and they were 4 hours each.
All right. And the dosing, do you remember what it titrated up to?
Yeah, I just happen to remember. It was about 135 milligrams per hour. Yeah, about that.
And what were the results?
The results, there was some evidence of improvement. But in the legs, which concerned me the most because of the possibility of pulmonary embolism, there was hardly any movement at all. That was my biggest concern. And I think the time is ticking, because a pulmonary embolism is something you can say, well, it's going to happen 3 days. It can happen at any moment. Any moment. And you got a crisis on your hands. Yeah. So that made some sense of urgency to the situation.
So how did you then respond if your outpatient infusions are not working? What was your suggestion?
My suggestion was that based on my experience of having done other kids with the high dose, the anesthetic dose of ketamine for 5 days, that would be something for them to consider carefully. And the way I wanted to make that happen is I put them in touch with some other kids, children that we've done in Tampa. I mean, from our surgery center, and they've given permission to disclose their name. In fact, they posted their stuff up. But the point is, we had 2 kids that had gone down to Monterrey, Mexico, that had that done, and so I put them in contact. I said, don't make a decision, talk it over. I put you in contact with Dr. Cantu down there. Here's his phone number. I will send him all your records if this is something you want to do. And we do go through. This is not a research now. Keep that in mind. This is about treating Maya out because she needed some urgent care to protect her.
Let me ask you about your relationship with Dr. Cantu and his clinic there. Do you get referral fees or anything out of this?
No.
And do you do a I guess before they fly down there, do you do an examination to see if they're physically ready for that?
Yes.
And you get paid for that?
Yes.
So then they decided to do that, to go to Mexico?
Yeah, well,
where else is it offered, by the way, besides Mexico? Was there any place else?
No, to my knowledge, at that time.
Had it been offered in Germany before?
Well, Germany, as far as I know, it's so far away, and so Dr. Schwartzman and I decided to go move in another direction.
Got it.
And the other thing about it is Dr. Cantu, again, I don't want to spend a lot of time on this, but he had a patient he wanted me to help with. I flew down there to help him with the patient. Put that patient under general anesthesia with ketamine for a week, and she did fantastic. And so with that, we decided to try to get institutional review board approval to do patients in a study.
Dr. Kirkpatrick, I really need you to answer the question that's asked, and I know there's a lot of other information, but it's important that you only answer the question that's asked and not throw in additional commentary.
I understand.
I appreciate it, Mr.
We're on limited time here. Okay, so did you speak with the Kowalskis or otherwise find out how the ketamine infusion down in Mexico went after they returned?
Yes.
And how was it?
It's great. She started moving her arms, and she had full function of her arms. She could take care of herself. She could comb her hair, brush her teeth, eat with her hands, and so forth.
All right. Now, was it necessary at this time do you terminate the ketamine infusions, the outpatient, or do you try to keep up with these, and if so, why?
Well, we have found over the years that sometimes these patients, after they have, not all of them, but some of them, after we do them, they have to have what they call it a booster, okay? They come back. Remember what I said, it's the conscious sedation. They are awake when you do it.
Got it. So they need a booster.
A booster, yeah.
All right. What about after the booster and they come back to the United States? In Maya's case, did she continue with ketamine infusions as necessary?
Yes, she did.
And who did you refer them to?
Dr. Hannah.
And why Dr. Hannah?
Well, we're a research center. Again, trying to keep this succinct as I can.
Okay.
Please. We're a research center, so most of my patients are coming in and they're paying out-of-pocket cash.
Okay.
And the reason for that is we can't do research unless we have money. And that money comes from...
Hang on. Let's just stick with that. And so then why Dr. Hannah? Because you're a research center and you're not set up for...
For insurance.
Yeah, and for long-term infusion. I mean, to keep going steadily as necessary.
Right. And the other reason, I knew him well. He's my next-door neighbor across the bridge.
Okay.
I knew him. I've been to his facility. I know what he does. He's one of the most caring doctors I've ever met when it comes to patient care.
And so then, were you aware at this time that Maya had eventually had a port put in to facilitate the infusions?
Yes.
And do you know what hospital that was done at?
Johns Hopkins.
If I could show, publish in evidence 2041-036. I believe this is from Dr. Elliott, I think. Is this Elliott's? $2041-036.
You know what? I'll move on. You guys let me know. All right. So Johns Hopkins actually put the port in.
Correct.
And through the course of 2016, did you ever receive a call back, leaving out eventually the October events, but did you ever get a call back from anybody at Johns Hopkins that was questioning or concerned about Maya having received the ketamine treatment?
No.
In Mexico or with Dr. Hanna?
No.
And to the best of your knowledge, how was Maya doing over the course of the spring and summer?
When she came back from Monterey?
Mm-hmm. Yes.
Yeah, she was, well, I did evaluate her when she came back.
Okay.
And she had full function of her upper extremities. I don't recall there being any.
Excuse me, Counsel. I'm sorry. Can we get a date on that?
When
he's talking about evaluation he did, I'd like to know what date it was.
Oh, sure. Doctor, did you do an evaluation in 2016, or was this from accounts reported to you?
I did do evaluation. It was about 2 weeks after they came back, roughly.
Okay. All right. Okay. So through the course of this time, then nothing from Johns Hopkins, and then did you learn that Maya had a relapse in the late, well, I guess it would be early fall, very late summer?
I think I did, and I don't know how I got the information, but it had.
You don't have the source of information here. This appears to be hearsay. He's testifying to third-hand information.
Madam Court, can I have the question back, please?
Question. Okay. All right. Okay. So through the course of this time, then nothing from Johns Hopkins, and then did you learn that Maya had a relapse in the late? Well, I guess it would be early fall, very late summer.
I
overruled the objection. You can answer.
I can't recall that specific. The one thing, well, anyway, I don't recall something of that nature. I think there was, but I'm not absolutely sure about it.
Did it come to your attention that Maya was checked into Johns Hopkins All Children's Hospital in the fall of 2016?
Yeah, yes, I'm aware of that.
All right. And did there come a time that you had a conversation with one of the doctors there? Did you ever have a conversation with Dr. Smith?
Yes.
And tell the jury a little bit about how that came about.
Quick. The way it came about was that I had received a notice, and the notice was that they wanted medical records, and so I was wondering what that was all about.
Okay.
So I called. I found out it was Dr. Smith there at the hospital that was doing the investigation.
Okay.
So I called, and she wasn't immediately available. She called me back.
You have a conversation with her then?
Conversation, right. And I thought, this is going to be easy for me, because on my committee, I have a scientific advisory committee I'm the chairman of, and she's on my committee, Dr.
Yes, Your Honor. This is not responsive to the question.
Let's get the next question.
Right. Let's pull up then 2118-036. I believe it's partially redacted. It's a note from October 11th, 2016.
I don't believe 2118-026 is in.
It's not it. This is not it. That's not it.
It's not?
Yes, it is. It was in this morning.
I thought it was 36, 37.
Yeah, this is 36.
I thought you said 26. I'm sorry.
No problem. 2118-36.
Okay, my apologies.
36.
And through the course of this, then you had, I gather, a conversation about the Kowalskis.
Yes.
And what was your concern here, having received the request for medical records and knowing that Maya was over now at Johns Hopkins All Children's Hospital? What's your general concerns about this?
Well, the day before, I had sent a message to to Beata, the mother, and I hadn't heard a while from them, so I was curious what was going on. Then I get this note for records, and I'm going, because I want her to come to see me to reevaluate Maya. And then they're asking me for records, and I don't know what was going on. So I called and talked to Dr. Sally Smith, and she represented herself as being a part of the medical staff there at All Children's.
Excuse me. Objection. Hearsay is called the witnesses editorializing about who she's associated with.
Pardon me, Commissioner.
Well, I'm going to overrule that objection.
Let's look at, and what I'll represent to you is a personal note from Dr. Smith of October 11th, 2016, and ask you to review that, see if it refreshes your recollection as to the different topics that at least Dr. Smith took down here of your call. So what did you discuss?
Excuse me. Object, Your Honor. The witness said he doesn't have a recollection of this. He's being shown somebody else's record to comment on it or
Speaking
interpret.
objection.
Let's go to only legal bases. Do you recall the conversation?
Yeah.
So you don't need the notes to refresh your recollection?
I did it right after the conversation. I documented a memorandum.
That's not in evidence. We can't talk about that.
Okay,
So it'll just
all
be
right.
this.
Well, I can remember what's on the memorandum if that's helpful.
Okay. Then
Why don't we take this down and then you
I'll
just
have
answer Mr. Anderson's specific question and only the specific question.
yes. Tell the jury what you told Dr. Smith. First, I'm sorry. Did she ask you any questions before you told her things?
No, she didn't ask me anything.
What did you tell her?
I
Hearsay, Your
said,
Honor.
Overruled.
You can answer.
yeah. I wondered what's going on. I understand you're with, Johns Hopkins, and tell me what's going on with the child and why I'm getting asked for records.
Did she give you a response?
Yes, and I can't remember the exact, words, but basically she was saying that there was a doctor over the weekend that saw the child and was concerned because when they lightly touched the skin of the child would jump, and that didn't make any sense to them. And they mentioned something about, that didn't make any sense. And it was not just in one area, it was pretty much both upper and lower extremities. And that didn't make any sense. And they were concerned that by the history that had been taken, that this might be some kind of a child abuse situation. And that really got me very concerned about the situation.
And before you tell us what you told her, in your experience, is it common or uncommon for doctors not familiar with CRPS to jump to a psychological conclusion before finishing their differential diagnosis?
Correct.
Legal basis.
Irrelevant, overbroad, vague, has nothing to do with the situation that we're addressing.
Overrule all of those.
Yes, it is, because this is a neurological disorder, and it has some signs and symptoms, and it carries with it a history. And if you don't know about that, it may seem a little bizarre. How is it that this child can have this sensitive skin all over?
So you'd seen this happen before, where?
Oh yeah.
And so to, I guess, protect your patient, what did you tell Dr. Smith?
Well, when she suggested the Munchausen by proxy, and she did mention that, I said, well, with due respect, she has multiple objective findings that far exceed the criteria that we accept as a standard of care right now, the Budapest criteria, far exceeds those requirements.
So you told her about the
Budapest. It's absolutely clear. There's nothing. This is it. This is what you got. And I said.
So hang on. So you told her about the Budapest criteria? That was the standard?
Right. That was the standard of care.
Okay. And then.
Leading and argumentative, and need to have questions being responsibly answered.
Well, I'm gonna overrule the leading, and let's just make sure you answer only the question that's asked.
Yeah, I'll give you cues there. All right, so now I forgot where I was. I was asking, did you provide Dr. Smith with the criteria to use in evaluating CRPS?
I did. I pointed out my findings, yes.
Did you tell her how your findings met up with the Budapest criteria?
I did.
Did she say anything?
No.
What else did you tell her?
Well, I emphasized that the findings were objective, could be easily verified, assuming, stating that this is not something that's my opinion. It's really something that's documented, not just by me, but in the scientific literature. And
Jack Bolstrom.
Do you know what
Overruled.
Do you know what Dr. Smith's specialty was? What kind of doctor she was?
Pediatrician.
And so, was that a concern to you that whether she had the training or ability to recognize this, or should she have been able to recognize it as a pediatrician?
We're talking recognize the CRPS.
Yes.
I don't think the average pediatrician would. Well, no, I wouldn't say that. It's just that. I got the impression she just didn't really know hardly anything about what we were talking about.
Okay.
But I think most pediatricians, because this is the most painful disorder you find in kids, that they would know about it, and especially since the kids come in, as I said earlier, with a very unique picture in front of your face, the dystonia.
Your Honor, excuse me.
So forth.
We're editorializing beyond the scope of the question.
I thought that one was fair.
We're getting perilously close to opinions that this witness does not have the statutory competence to make.
Yeah, overrule that objection, but sir, I really need you to only answer Mr. Anderson's questions without adding on anything.
Okay.
Really important.
I'll work on it.
Well, I need you to do more than that. I need you to do that because it's really important that you do that.
Sure.
Did you warn off Sally Smith from accusing this family of Munchausen by proxy?
Yes.
And did she respond to you with any particular questions about what these symptoms were or why you were warning her off?
No.
Did you tell her about the allodynia?
Yes.
Did you tell her about the dystonia?
Yes.
Did you tell her about temperature changes?
Yes.
Did you tell her about the, and I'm not sure you documented this, the sweating or any other symptoms as signs that you had noted?
I don't remember those in particular, but the ones that I had documented, I did reference those to her.
All right. And so how long was this conversation?
I would estimate maybe 30 minutes, something like that, approximately.
And did you explain to her about generalized neural sensitivity?
Yes. Oh, yes.
And so after all of this, again, any response from Dr. Smith of an inquisitive nature about what the distinction was between Munchausen by proxy and CRPS?
No.
Now, in follow-up to this, did you have any more communication with either Dr. Smith or the hospital about this situation? The situation being Maya Kowalski in the hospital and a diagnosis of Munchausen by proxy as to the mother?
No.
The embolism you spoke about before. Did Beata Kowalski question you about this, I don't want to call it phenomenon, but this circumstance that this embolism was a danger potentially to Maya?
Yeah, she did query me on that.
And did she continue to follow up about this?
Yes.
What did you tell her? Strike it. What did she tell you about her concerns over improper care of her daughter?
I think her concern was her.
Hearsay and standard of care.
Well, overruling the standard of care, I think I'm going to sustain the hearsay nature of that question, though.
3 or 4? 803, 3 or 4? With the
I don't think you've got a foundation for that question for that exception.
Did you still consider Maya Kowalski under your care?
Yes.
And were you attempting throughout this period to keep yourself apprised of Maya's medical condition?
Yes.
Object to foundation, Your Honor. The record will reflect this witness had last seen the patient 10 months ago.
Let's, again, no speaking objections, so let's not do that.
I'll be happy to approach.
I don't need an approach on this one. I'm overruling it. You can continue.
And from time to time, did Beata Kowalski provide you with updates on how Maya was doing over the course of the spring and summer of 2016?
Yes, sir.
Did she continue to use you as a source of information about Maya's progress and symptoms and treatments?
Yes.
So at this point, when Beata called you in the fall of 2016, was it for the purposes of updating you about Maya's care and her concerns?
Objection, Your Honor. He's asking for the state of mind of another.
Sustain that question.
What, if anything, was the purpose for that last call in the fall of 2016 between you and Beata Kowalski?
Same objection.
Overruled that one.
I'm not sure what date you're talking about here.
Did you have, during the fall of 2016, did you have any conversations with Beata Kowalski where the topic of this embolism starting in the leg was addressed?
Well, that conversation was before then, but yeah, she brought it up. She mentioned that her legs aren't moving. What is she going to get clots down there?
And to the best of your knowledge, did she participate in various, with this disease, were there chat rooms and websites where CRPS patients and their child, parent, could go to exchange information about the disease?
Yes.
And to the best of your knowledge, based on what she told you and your own knowledge, did Beata Kowalski participate in those from time to time to learn about CRPS?
Yes.
Objection, hearsay foundation.
Overruled.
So in this conversation then, did Beata ask you any questions about what would happen to her daughter if she continued to have care that was inappropriate to treating her CRPS?
Objection, Your Honor. May we approach?
Yes.
All right, so that is pretty much wrapping up this doctor's testimony. This is all very interesting to hear about kind of his background and his research. We can tell he's very passionate about the research that he's done and the things that he has developed to measure pain, which is interesting to hear that it wasn't just, from the outside, but rather within one's brain of what they're perceiving. So now we're actually going to just go into the verdict at this point. There's so many days of this trial as a whole. A lot of the other days are mostly pediatricians and things like that within the hospital, like, for example, the one that he was referring to that he spoke with. And they pretty much just go into, with the information that they were given, XYZ is what they concluded, which, as we know, are the things such as Munchausen, and also saying that she didn't have the condition that this doctor is stating. It's interesting to hear that he actually did speak to a pediatrician at the hospital, because that was one of my thoughts was wondering, why were the doctors that did diagnose her with CRPS, why were they not contacted? But apparently they were. So I'm wondering why that was thrown out as far as further consideration for that diagnosis, and why it seemed like they were just kind of going through the motions of seeking out her background and other doctors' opinions, but then kind of throwing it out. I'm almost wondering if when he probably discussed, her going to Mexico and getting the procedure, I wonder if that in the eyes of the doctors at the hospital kind of just like threw out the credibility maybe of the doctor in the eyes of the hospital or something like that. That's definitely something I'm going to be looking a bit more into as I create the curated video for this trial in that aspect, because it does seem odd that, there were doctors backing it up and coming forth explaining what they had found, and then that didn't seem to quite matter to the hospital as far as them doing their own research. It seemed like they were just trying to, separate her from her family and then keep her at some equilibrium of not just crying all day in pain. All right, so as I said, we're going to go to the verdict now from this trial, which is what we've been waiting for.
Okay, please be seated, everybody. Members of the jury, good morning. Good morning. And thank you again for being here early. I want to confirm while you were away, you did not discuss this case amongst yourselves. You did no investigation. You received no information. Is that all correct? Correct. And that's obviously since we broke yesterday from your deliberations. Is that correct? Correct. Okay. And has anyone approached you at all about this case? No. Have any of you seen any media accounts about this case? No. Okay. I've just asked the clerk to go re-deliver the evidence to you. I just heard the door close, so they're in the process of doing that. Let's talk logistics for a moment. Timing-wise, you all are, whatever you all do is going to be fine from a timing perspective. Remember, if you wish to continue to deliberate after today, we will have to bring you back on Monday. The courthouse is closed in honor of Veterans Day tomorrow. So if we're not finished with our work, we're going to bring you back next week. Okay. Anyone have any questions about that or concerns or anything like that? Okay. What I'm going to do is I have the sealed envelope. It does not look like it has been damaged in any way. Do the attorneys wish to look at the seal or anything like that? No. Okay, I'm going to hand the sealed package back to the jury, and we're going to let you recommence your deliberations, and we will await your question or verdict. Okay, you may begin deliberating.
All rise. Jurors exit.
Please be seated, everybody. Just give me a moment to get the computer going and turn on the feeds. This is case number 2018 CA 5321, Jack Kowalski, etc. et al. Versus Johns Hopkins All Children's Hospital. I've been handed a note from the jury that reads as follows. We have reached a verdict. Do the attorneys wish to look at the note?
Not on behalf of plaintiff.
Okay, I'm going to go ahead and file that with the clerk. Are there any issues we need to address before we bring in the jury?
Not on behalf of plaintiff, Your Honor.
Not from the defense. Disregard.
Do the parties need any moments to talk with each other before we bring them back?
I don't think so, Judge.
No, Your Honor.
Okay. For the folks here in the courtroom, I would ask that as this verdict is read, it's going to take a while to read the verdict, but as the verdict is read, I would ask that we not have any sort of audible or visual reaction. So please keep your emotions in check. At this point, let's bring in this jury.
All rise. Jurors enter.
Okay, please be seated. Okay, members of the jury, welcome back. I have been told, or I've received a note from you that you have reached a verdict. Is that correct?
Yes.
Can the foreperson hand the verdict form to the court deputy who will bring it to me? Clerk to publish the verdict, please.
In the 12th Judicial Circuit in and for Sarasota County, Florida, case number 2018 CA005321NC. Jack Kowalski, individually Jack Kowalski as parent and next friend of MK, a minor, and Jack Kowalski as personal representative of the estate of Beata Kowalski plaintiffs, versus Johns Hopkins All Children's Hospital Incorporated defendant. Verdict form. We, the jury, return the following verdict. Claim 1, false imprisonment, October 7th through October 13th, 2016, Maya Kowalski. 1. Did Johns Hopkins All Children's Hospital falsely imprison Maya Kowalski without legal authority under circumstances that were unreasonable and unwarranted between October 7th and October 13th, 2016? Yes. 2. What is the total amount of Maya Kowalski's damages for the medical and psychological expenses to be incurred in the future after she reaches the age of 18 based on the false imprisonment occurring between October 7th and October 13th, 2016? $2,496,000. 3. What is the total amount of Maya Kowalski's damages for pain and suffering, mental anguish, inconvenience, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future, based on the false imprisonment occurring between October 7th and October 13th, 2016? $3 million. 4. What is the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child, Maya Kowalski, in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18, based on the false imprisonment occurring between October 7th and October 13th, 2016? $67,200. 5. Under the circumstances of this case, state whether you find by clear and convincing evidence that punitive damages are warranted for the false imprisonment occurring between October 7th and October 13th, 2016. Yes. Claim 1, false imprisonment, October 18th through October 20th, 2016, Maya Kowalski. 6. Did Johns Hopkins All Children's Hospital falsely imprison Maya Kowalski without legal authority under circumstances that were unreasonable and unwarranted between October 18th and October 20th, 2016? Yes. 7. What was the total amount of Maya Kowalski's damages for medical and psychological expenses to be incurred in the future after she reaches the age of 18, based on the false imprisonment occurring between October 18th and October 20th, 2016? $1,400,000. 8. What is the total amount of Maya Kowalski's damages for pain and suffering, mental anguish, inconvenience, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future based on the false imprisonment occurring between October 18th and October 20th, 2016? $3 million. 9. What is the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child, Maya Kowalski, in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18, based on the false imprisonment occurring between October 18th and October 20th, 2016? $561,298. 10. Under the circumstances of this case, state whether you find by clear and convincing evidence that punitive damages are warranted for the false imprisonment occurring between October 18th and October 20th, 2016. Yes. Claim 1, false imprisonment, January 6th, 2017, Maya Kowalski. 11. Did Johns Hopkins All Children's Hospital falsely imprison Maya Kowalski without legal authority under circumstances that were unreasonable and unwarranted on January 6th, 2017? Yes. 12. What is the total amount of Maya Kowalski's damages for medical and psychological expenses to be incurred in the future after she reaches the age of 18, based on the false imprisonment occurring on January 6th, 2017? $188,000. 13. What is the total amount of Maya Kowalski's damages for pain and suffering, mental anguish, inconvenience, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future, based on the false imprisonment occurring on January 6th, 2017? $15 million. 14. What is the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child, Maya Kowalski, in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18, based on the false imprisonment occurring on January 6, 2017? $325,000. 15. Under the circumstances of this case, state whether you find by clear and convincing evidence that punitive damages are warranted for the false imprisonment occurring on January 6, 2017. Yes. Claim 2, battery, January 6, 2017, Maya Kowalski. 16. Did Catherine Beatty and any bedside nurse commit a battery on Maya Kowalski on January 6, 2017? Yes. 17. What is the total amount of Maya Kowalski's damages for psychological treatment incurred in the future after she reaches the age of 18, based on the battery occurring on January 6, 2017? $4 million. 18. What is the total amount of Maya Kowalski's damages for pain and suffering, disability, physical impairment, mental anguish, inconvenience, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future, based on the battery occurring on January 6, 2017? $8 million. 19. What is the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child, Maya Kowalski, in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18 based on the battery occurring on January 6, 2017. $559,000. 20. Under the circumstances of this case, state whether you find by clear and convincing evidence that punitive damages are warranted for the battery occurring on January 6, 2017. Yes. Claim 2. Battery, hugs, pats, kisses, and placing on lap. Maya Kowalski. 21. Did Catherine Beatty commit one or more batteries on Maya Kowalski through hugging, patting, kissing, and placing Maya Kowalski on her lap? Yes. 22. What is the total amount of Maya Kowalski's damages for psychological treatment incurred in the future after she reaches the age of 18 based on Catherine Beatty's hugging, patting, kissing, and placing Maya Kowalski on her lap? $8 million. 23. What is the total amount of Maya Kowalski's damages for pain and suffering, disability, physical impairment, mental anguish, inconvenience, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future based on Catherine Beatty's hugging, patting, kissing, and placing Maya Kowalski on her lap? $11 million. 24. What is the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child, Maya Kowalski, in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18 based on Catherine Beatty's hugging, patting, kissing, and placing Maya Kowalski on her lap? $1,000. Claim 3, medical negligence, Maya Kowalski. 25. Was Dr. Sally Smith an apparent agent of Johns Hopkins, All Children's Hospital, at the time and place of any treatment she provided to Maya Kowalski? Yes. 26. Was Dr. Sally Smith negligent in the medical care of Maya Kowalski? And was that negligence a legal cause of loss, injury, or damage to Maya Kowalski? Yes. 27. Excluding and not considering the conduct of Dr. Sally Smith, were one or more healthcare providers negligent in the medical care of Maya Kowalski at Johns Hopkins All Children's Hospital? And was their negligence a legal cause of loss, injury, or damage to Maya Kowalski? Yes. 28. What is the total amount of Maya Kowalski's damages for lost earnings in the past, loss of earning capacity in the future, medical, psychological, and nursing care and treatment expenses to be incurred in the future? $4,700,000. 29. What is the total amount of Maya Kowalski's damages for pain and suffering, disability or physical impairment, mental anguish, inconvenience, aggravation of a disease or physical defect, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future? $22 million. Claim 4, fraudulent billing for Mr. Kowalski. 30. Did All Children's Hospital fraudulently misrepresent a material matter in its invoices to Jack Kowalski or his insurers? Yes. 31. Did Jack Kowalski or his insurance company rely to their detriment on the fraudulent misrepresentation you found in answer to question 30? Yes. 32. What is the total amount of Jack Kowalski's damages for any deductibles or co-pays incurred as a result of Maya Kowalski's sheltering at Johns Hopkins or increases in the cost of insurance coverage in the past or in the future, including increased premiums, co-pays, and higher deductibles? $3 million. 33. What is the total amount of Jack Kowalski's damages for the difficulty of finding insurance in the future? $2 million. Claim 5. Survivor claim for the intentional infliction of emotional distress in the estate of Beata Kowalski. 34. Did Johns Hopkins All Children's Hospital, through the acts of its employees, engage in extreme and outrageous conduct, intending that conduct to cause or with reckless disregard of the high probability of causing severe emotional distress to Beata Kowalski prior to her death? Yes. 35. What is the total amount of Beata Kowalski's damages for pain and suffering or mental anguish caused by the extreme emotional distress prior to her death on January 7, 2017? $3 million. Claim 6. Wrongful death claim for intentional infliction of emotional distress causing death in the estate of Beata Kowalski. 36. Did Johns Hopkins All Children's Hospital, through the acts of its employees, engage in extreme and outrageous conduct, intending that conduct to cause or with reckless disregard of the high probability of causing severe emotional distress to Beata Kowalski that was sufficient to be a legal cause of Beata Kowalski's death by suicide? Yes. 37. Did the conduct that you found in question 36 create in Beata Kowalski an uncontrollable impulse to die by suicide? Yes. 38. Was the conduct that you found in question 36 a substantial factor in Beata Kowalski's death by suicide? Yes. Question 39 addresses damages of the estate. What is the total amount of any damages sustained by the estate for loss of net accumulations? $653,676. Question 40 and 41 address damages of surviving spouse Jack Kowalski. 40. What is the amount of any damages sustained by Jack Kowalski for the loss of Beata Kowalski's support and services and funeral expenses resulting from Beata Kowalski's death paid by Jack Kowalski? $18 million. 41. What is the total amount of damages sustained by Jack Kowalski for the loss of his wife's companionship and protection and for his pain and suffering as a result of Beata Kowalski's death? $50 million. Number 42. What is the total amount of damages sustained by Maya Kowalski for the loss of Beata Kowalski's support and services? $2 million. 43. What is the total amount of damages sustained by Maya Kowalski for the loss of parental companionship, instruction and guidance, and Maya Kowalski's pain and suffering as a result of Beata Kowalski's injury and death? $18 million. Question 44 and 45 address the survivor damages of Kyle Kowalski. 44. What is the total amount of damages sustained by Kyle Kowalski for the loss of Beata Kowalski's support and services? $2 million. 45. What is the total amount of damages sustained by Kyle Kowalski for the loss of parental companionship, instruction, and guidance, and Kyle Kowalski's pain and suffering as a result of Beata Kowalski's injury and death? $18 million. Claim 7. Intentional infliction of emotional distress, Maya Kowalski. 46. Did Johns Hopkins All Children's Hospital, through the acts of its employees, engage in extreme and outrageous conduct, intending that conduct to cause or with reckless disregard of the high probability of causing severe emotional distress to Maya Kowalski? Yes. 47. What is the total amount of Maya Kowalski's damages for lost earnings in the past, loss of earning capacity in the future, medical expenses incurred in the past, and medical expenses to be incurred in the future? $3 million. 48. What is the total amount of Maya Kowalski's damages for pain and suffering, disability or physical impairment, mental anguish, inconvenience, aggravation of a disease or physical defect, and loss of capacity for the enjoyment of life sustained in the past and to be sustained in the future? $7,500,000. So say we all, this 9th day of November 2023, four-person.
Hand me back the verdict form, please. Do the attorneys wish to inspect the verdict form?
Yes.
Please come. Oh, counsel, please come forward if you wish to inspect the verdict form.
All right, that was extensive for sure as far as the money received and everything that they were found guilty of. So all in all, Maya's family was granted over $261 million, and $50 million of that was punitive damages, meaning that was intended to financially harm, if you will, the hospital. And 212 of that was the part of the lawsuit in general. So that is a lot of money that they ended up getting from the hospital, more than I feel like a lot of people expected, honestly, in the end. Especially for a case like this, you know, it takes a lot to take a hospital to trial. And as we know in this case, it took many, many, many years and many filings on the hospital's end of pushing this trial off. Obviously, they didn't want this to go to trial. They didn't want a lot of the evidence to be brought forth into the public either. So that wraps up this trial of what we're going to cover. And I just want to point out some things, food for thought, kind of that popped into my mind as I was listening to all this testimony. One is that there were two biases I feel like that could have happened. It's speculative, of course, but it just got me thinking that one of the biases would be that Maya's mom was an infusion nurse. So it kind of makes sense that she was as open as she was to all the ketamine infusions as a solution for Maya's treatments, despite them possibly seeming a bit extreme. On another note, the other bias that was interesting on the other side would be the social workers, right? If they're trained highly in Munchausen by proxy, that could have really been at the forefront of their thoughts when evaluating children. And that could create the bias of kind of seeing more symptoms or things like that that align with Munchausen syndrome. So that could have been their bias. So honestly, each side could have had their biases toward what they wanted to believe from the get-go. So I just thought that was interesting. Also, in general, just playing devil's advocate on all sides, I can totally see, you know, so many people's different arguments for this case. It's a tough case as a whole. Just wanted to point out a couple things. So some people I've heard believe that Maya was faking the illness, which I do find a little bit tough to believe, as I would be shocked that a child would continue faking this even after being taken from their family. Others believe that, obviously, that there was Munchausen by proxy, which was the whole crutch of this case, which I could definitely see the possibility of her mother putting these thoughts and conditions into the child's mind as she was at a very impressionable age. And she's always wanted to please her mom. She's stated that throughout her testimony as well, of, you know, following in the footsteps of their church-going ways and continuing things even after her mom's death in an attempt to please their mother. And in addition to like learning Polish, right? She said she really wanted to learn Polish to please her mother. So I can see that side for sure of maybe putting it in her mind. If it was Munchausen, then I would wonder, why would the mother, if she was wanting to inflict her child to be sick or to present as sick, why would she allow her daughter that year of being healthy after the ketamine infusion treatment for the 5 days that she was in that coma? That would seem odd to me, to let her kind of be relieved of that for a whole year, if you will. I also can totally understand that Maya may have reacted more in front of her parents, which is another argument, saying that when she was in the hospital, maybe she wasn't reacting as much, maybe she wasn't having as many outbursts, if you will. And, that's typical behavior of a child anyway, to feel more comfortable around their parents. So they would inherently react more. We see with like babies all the time, right? So that's also totally believable, totally understandable that would be the case, to present a bit more in front of her parents. However, all in all, at least for my observations, based on multiple doctors' diagnoses, that the hospital was at least more in the wrong in the way they dealt with certain situations, for sure. So that's just my take on it as a whole. Doesn't mean, that there weren't some questionable things on either side. I definitely would love to hear more about your guys' thoughts and perceptions and what you believe one way or another. And, it doesn't make it all black or white, right? It can be somewhere in the middle, just like with many cases, especially when it has to do with these psychological issues that are presenting as well. So as always, guys, thank you for hanging out. Super appreciate you guys experiencing this trial with me. And I will see you guys on Sunday for the premiere that we're going to have. And have a great weekend otherwise. And I'll see you guys on Sunday.